to find ways of enhancing fight against the spread of HIV infections, whose relevance rate still stands high in the county. During the conference, Dr. Momanyi states that though they have made great strides in reducing the HIV prevalence rate over the last 5 years, they are still facing a myriad of challenges. NET also encouraged those who are on drugs to ensure a total adherence, while calling on those who are HIV negative to ensure they embrace prevention of drugs to help in preventing new infections.
No. Using the studies.
My name is Zilpa Imbuye. I work in the Department of Health. I coordinate mother-to-child transmission of HIV/AIDS. Today we have a conference on best practices, and our theme is changing the aging HIV epidemic, which as a county, it's of key to us because as now, our prevalence is quite high, around 14.1%, while the national target is at the prevalence of 4.6%. And when we come to issues of mother-to-child transmission, we are also doing 7.1% against the expected transmission rate of below 5%.
This is Dr. Momanyi Geto. I'm the HIV treatment advisor for CHS in Kenya. We have a project in Siaya that does HIV and TB treatment, plus other illnesses around HIV and TB, like cervical cancer and other malignancies and comorbidities that affect people living with HIV. So about the conference today, I think from the theme you'd see we're talking about the responding to the aging and changing epidemic. Over the years, I think we've had close to over 30 years of close to 40 years right now of HIV pandemic, and with time we are seeing changes. So we have to change to respond to how the epidemic has been changing. So initially in the epidemic, even in Kenya, we are seeing very sick patients who come to the hospital very sick in advanced HIV disease. Most of them would die from opportunistic infections like TB, bacterial infections, and the likes. But over time, and especially with the introduction of very strong antiretroviral treatment for HIV, we have seen that over time people are living longer, people are living healthier, and the typical HIV patient who you'd see very sick, we don't see them much now.
Our patients have high level.
And in the sporting world, the youth from Tongaran